Good afternoon and welcome to the Medical College of Wisconsin's Coffee Conversation with Scientists. I'm your host, Raina Andrews, and for those tuning in for the first time, let me introduce myself. I'm a mother, a children's book author, a public health ambassador, and an engaged community member. I am your host for the 2023 Coffee Conversations with Scientists series. Coffee Conversations is brought to you by the Advancing a Healthier Wisconsin Endowment, which is a statewide nonprofit really working to improve health and advance health equity in Wisconsin. Since early in 2021, we have been sharing the science behind today's most important health topics. Now, today, I'm joined by Dr. Carlos Figueroa Castro, who is the Assistant Professor of Infectious Disease at the Medical College of Wisconsin, to learn about the importance of immunization, early detection, and infection prevention. Welcome, Dr. Figueroa Castro.
Thank you for the invitation.
Yes. So folks out there in the interwebs, we will be covering a great list of questions regarding the triple-demic and immunization. So if you're coughing or sneezing this fall, you'll know how to protect yourself and your loved ones. We have a lot of questions to get to, but the beauty of having a live session is that we will call on you at the end, so please get your questions ready. All right, Dr. Figueroa Castro, can you please provide an overview? I've heard this term triple-demic used quite a bit. Can you help us break down what exactly is the triple-demic and how is it caused?
Yeah, so the triple-demic concept, I guess it got into vogue when we started seeing the impact of not only COVID-19 infection, but also when we had some ease up on the restrictions and measures that we have to help control some of the number of cases that incidentally had also an impact on the number of other respiratory infections, namely influenza and RSV. And so when we had these restrictions, we noticed that also helped decrease the number of infections for RSV influenza. And then when those measures got phased out, then we saw an upsurge on all those classic respiratory infections. So it was just the conundrum, the conjunction of having COVID, RSV, and influenza. So that's where this triple-demic concept is coming from. We obviously have more respiratory viruses out there that you can count by the dozens, different viruses that can cause respiratory symptoms. But these three are obviously the most important one for us because they can cause severe disease. They can cause some difficulties in increasing the number of people requiring visits to the doctor, admissions to the hospital, more intensive care, and obviously patients can die from severe disease. So that's I think a way to encompass the importance of not only looking for COVID-19, but for other viruses that are important from a clinical and public health perspective.
Wow. So really the triple-demic is having in the marketplace the viruses of COVID-19, the flu, and RSV. So can you tell me, is that right? Am I understanding correctly?
Correct. So yeah, for the purposes of this conversation, those will be the three main organisms that are important for us. And obviously now that we're in the process of having a new season on when respiratory infections in general go up, which, fall and winter, then obviously we're looking very closely what's going to happen with these three infections in the coming months.
Mm-hmm. So 'tis the season where kids are going back to school, they're touching things, they start coughing, they start sneezing, and all seem to be symptoms where they can either be COVID-19, the flu, or RSV. Can you share a bit about what are some of the symptoms, severity? What do we need to know so that we're properly diagnosing things?
Yeah, that can be very tricky at the beginning. Many of those respiratory infections have very similar clinical presentations. So especially at the beginning, you might have the malaise, the fatigue, the coughing, the sore throat, runny nose, muscle pains. And then after, you might have something more severe, having coughing, chest discomfort, wheezing, But it's very difficult to distinguish clinically whether this infection could be related to COVID, or it could be related to influenza or RSV or other respiratory virus. So there are some symptoms that we think might be more common in certain infections. Usually I think a lot of people are already aware that, some patients, for example, with COVID-19 experienced problems with the sense of taste and smell, and which we didn't see as much with other respiratory infections. But if the fact that if you don't have those symptoms, that doesn't mean that could be COVID and vice versa. So it's a little bit difficult to distinguish that clinically, frankly. So that's why we are very pushing a way to tell patients that if you have any respiratory infection that seems to be maybe a little bit more than just a common cold, thing that maybe doesn't quite resolve on its own very rapidly, that is very important to be diagnosed correctly. And because some of those infections, we have antiviral therapy that we can start. And obviously, the sooner we start the treatment, the better. You tend to work better if the diagnosis is done rapidly. So we would like to encourage people to seek medical expertise and having some testing to try to help discern what kind of infection we're dealing with. And obviously there is the advantage nowadays of also having home testing, where you can do some rapid testing in trying to figure out if at least this is COVID, not COVID, and obviously in conjunction with your health provider.
Got it. So you talk about antiviral therapy. What is that?
So there are some medications that are specific in trying to control these infections. Generally speaking, the viruses, but the most part respiratory viruses, and thankfully most of those infections go away on its own. The body most of the time is able to deal with that by different mechanisms that our body is able to do, or immune system. But there are some other viral infections that we have dedicated medications that can help curb down the multiplication of the viruses by different means. So for example, for influenza, we have oseltamivir, which is a very common medication that we've been using for some time, obviously. And now with the COVID-19 pandemic that was accompanied by a tremendous source of clinical, basic, and translational research that included treatments that are very specific for COVID-19 infections. So nowadays we have medication that can be given orally for mild to moderate cases, and IV medications that can be given for more severe cases. And the idea is to try to affect different parts of what the life cycle of this virus goes through in order to affect the host. So there are medications that, for example, inhibit or slow down the process of multiplying the genetic material of the virus. When the virus is multiplying, it has to also carry some of that genetic material. And there's one medication that kind of blocks that, for example. Or there are some other medications where we know that after the genetic material of the virus gets translated into a protein, those proteins need to be chopped down in smaller proteins, and there is a specific protein in the virus that does that. So there's another medication that blocks that particular protein that does that. So in the end, then the virus doesn't assemble the right way, and it doesn't work.
Wow. So I don't want this to go over our audience's head. So the way that I'm understanding this is this show is about immunizations. When I think about immunizations, I think of vaccinations. What exactly is an immunization? Because it sounded like you were describing how it helps protect your body.
Yeah, so immunization is more of a larger term than vaccination. Vaccination is a way to promote that immunity, but it's not the only way to provide protection or immunity to a person. So when we talk about vaccines, we're talking about active immunization, where we give the individual something very similar to what we are trying to protect. So the body produces a similar response to kind of provide that immune response while trying to protect the person from having some of the side effects of having the real infection. So that's a way of immunizing a person. So that's an active process where your body has to look at what the vaccine component is, and then that triggers some specific immune responses that we take advantage of, and the body gets some protection. So that's way of being immunized. That is an active process. But in some other occasions, or depending on the circumstances, or maybe not having a vaccine for certain conditions, we do what we call a passive immunity, which is actually giving the person the actual antibodies that are very specific to the infectious agent that we want to protect. So, for example, in the case of COVID-19, there were some monoclonal antibodies. So we have a molecule that is able to detect a specific piece in the surface of the virus that helps tell the body, say, look, this doesn't belong here. And but it's something that doesn't last forever. It has a lifespan, but the effect is right there. You're just giving the antibodies that with the vaccine you're supposed to form on your own. But in the end, it's immunization. It's just a different mechanism.
Got it. So for the flu, I always see whenever I go to the pharmacy, get your flu shot, get your flu shot. So that's a new. So flu, there are different strands that come out, kind of like COVID, there are different strands. And so when they're promoting, hey, you should get your booster, it's because there's a new variant. So you need to now protect yourself from this new variants.
Correct.
Can you share more about these immunizations or these vaccinations and why they're so important to protect ourselves?
Yeah. So, I mean, obviously, we have to maybe go back a little bit and talk a little bit why we recommend different vaccines through the season. So, for influenza, for example, that it's a very robust public health system where we had really good monitoring of what kind of strains or variants that are circulating in the community. And for us, that's very important because based on that information that we collect from different places around the country and around the world, that's how they can determine what kinds of specific vaccines get into that product. So when we talk about the flu vaccine, you're actually getting vaccines, you're getting 3 different compounds to try to cover for different strains in that vaccine. It could be 3 or 4 components, and that combination is driven by what is circulating in the community. And for influenza, that has been known for decades, that surveillance is very robust. And every year, then when is the time to decide what to put on that vaccine, then is based on that information. And then when they decide, hey, we need to cover this, and this, because those are the most common virus circulating in the community, then that get down to manufacturing and all that. And that's how these vaccines get concocted in a way. So I think the situation for influenza is, again, very robust, very well known, because that virus mutates, the genetic material changes, and sometimes the changes are very small, so there's not a lot of variability, but sometimes the changes are very large, up to the point that not a lot of people in the community might have that protection from previous infections, and it's like starting like not having immunity at all. So that's when we get concerned about, for example, a novel case of influenza that might have a potential for cause a pandemic. But for this influenza vaccination, again, we design what kinds of strains to cover based on what we are able to monitor. Now, similarly for COVID-19, we have a very similar situation where there's a lot of research in determining what kind of variants, what kind of changes we have seen in this virus. So it's just a different way to know how these viruses evolve through time by natural mechanisms, or and based on that, then the vaccine gets gets designed. So in this situation, for example, again, you remember, after we started having all these issues with the pandemic since early 2020, we have seen different names showing up in the news, like Delta and Omicron and all that, which are kind of like this maybe catchier names for some different variants. Obviously there is a nomenclature for scientists to determine the changes, which family of viruses we're talking about. But I think for the rest, for the common person, maybe a little bit easier to say it's Omicron, is that? So you probably, that's what you have seen on the news. So that vaccine creation is based on what is circulating in the community.
So there's a new variant for COVID-19. What is this new variant called?
So this variant is kind of descendant from what we call Omicron.
Okay.
And there have been some small changes in that variant. So there are different names that based on what is circulating. So it's EG5 and BA2.86. So again, those names may be not as catchy as saying Omicron, but those are kind of the two variants that we have seen are kind of creeping up and becoming the most common variants out there that are causing disease in the community. And thankfully, the vaccine for this season, we think that it has good coverage against those circulating strains.
So that's great for my next question. So can you explain the current recommendations regarding the COVID-19 booster shots, especially in the context of a potential triple-demic? Like, who should really consider getting a booster?
Yeah, so I mean, in general, I mean, there should be a person needs to get the COVID vaccination. Obviously, we probably are more pushy in recommending that to patients who we think that are at a higher risk of having severe disease for COVID-19 infection. Again, very similar recommendations for influenza and RSV particularly. But in principle, we want people to get vaccinated if possible. With this new booster, which not sure it necessarily is a great word to imply what we need to be doing here, not sure it may be a catch up or just a seasonal COVID-19 shot. I think it will probably a better way to describe it. It's basically a way to kind of keep up with what is going on in the community. So the recommendations on whether to get one shot or two shots, those are very dependent on whether you have received a vaccine for COVID-19 before or not, or whether you are a person who have some problems with their immune system. So there are some particularities out there that tells you when to receive one shot or two shots, and is very dependent on the kind of product that you have received in the past. So remember that there are different vaccines out there for COVID-19, and depending on the product, there are also some minor variations in how to do this catch up or boostering, if you want to call it that way. And again, that information, obviously, your healthcare provider should be able to get that information. The health departments, the Centers for Disease Control has an excellent documentation on how to do that catch-up immunization. So it should be pretty easy for having a discussion with your healthcare provider.
I just want to ask one more question before we turn it over to our audience. And I'm wondering, what measures can people take to reduce their risk of contracting or really even spreading these respiratory infections in high-risk areas like airports, schools, healthcare facilities, crowded gatherings? In the fall, should we automatically go back? Well, we should always be washing our hands, but should we return to wearing masks?
Yeah, that's kind of an interesting question, I think. So again, obviously, vaccination is a key component in trying to protect you from infection. And obviously, the vaccination has also an effect on the population. If we decrease the number of cases or severe cases, we should expect also some decrease in the level of transmission. And obviously for us as healthcare providers as well, it might be a little bit easier to deal with a surge of infection. That was one of the big problems that we have in the last couple of seasons, where the healthcare system got into a lot of stress because of a surge in cases. So that's one effect of that. So in addition to the vaccination, obviously, like you said, the hand washing is very important. If you can implement some sort of cough etiquette, so you're coughing, obviously you want to cover your face or cover with your elbow. The use of the mask, obviously, there's a lot of not necessarily that, some discussions about the use. I think they are effective in decreasing the transmission if you have infection, and also to protect yourself from other people having. So if you are a person who are at a higher risk of infection, particularly, let's say you have an organ transplantation, or you have problems with that you're on dialysis, or things along those lines, I think using a mask, if you go to do your groceries, or you feel that you're going to end up in a situation where there might be some people around you, like you said, maybe going to an airport or something like that, I think a mask is a good measure to consider. And again, obviously, it should be a decision that should be respected as well. So I think it's just an extra layer of protection, especially if you are an individual that if you get sick, you can get into a lot of trouble.
So I think that brings up a really good point. Earlier on, you said that, if you're feeling symptomatic, it's almost like a process of elimination. It's a good job for you to take a COVID test. I now want to turn it over to some of the questions from our audience. And one of the questions is, can I still use the COVID home test that I have at my home from last year? Do they expire?
So that's kind of interesting, because I had the same situation actually last week. So I had I was having a cold, and I was obviously wondering if that was maybe COVID-19. And we were like kind of looking, I was looking, we had some of the tests that were given by, the government when they started doing it. And they're going to do that again, actually. So you're going to see that if you're interested, you can actually ask for a free test again. But yeah, the test was expired. So obviously, ideally you want to follow the manufacturer rules and make sure that test is valid. In my case, it was about 7 days. So you kind of wonder if it still works, doesn't work. I think the safest approach is if it's out of the date, then you have to use a new one. That will be the safest bet.
Mm-hmm. Do you have any resources on maybe when or where people can get tests? Is it just at the regular grocery store they should be available?
So again, the government they decided to distribute COVID kits to households, and I think they're planning to do that again for this season. Some of those kits are also available in regular, CVS, Walgreens facilities like that. And there's going to be some interesting developments in maybe having kits not only to test for COVID-19, but also for influenza. There's actually a kit that tests for COVID and flu. And RSV, not sure there will be much of a push to have one, but if you want to get tested for RSV, that's something that you have to touch base with your healthcare provider. So it might come in the future, but I think the priority will be for COVID-19 and flu home testing.
Got it. Another question from one of our viewers is, I've heard you should wait until later in flu season to get a vaccination so that you're getting the latest formulation for the current virus. Is there any truth to that recommendation?
Yeah, so obviously there was kind of a gap, for example, like around summer, early fall, where we know that this new shot was gonna come. And the other one, the bivalent one, was still kind of available. So you were kind of in the, like, should I get the old one or the new one? Mm-hmm. I think and obviously now it's a different situation. We know that it's coming and it's going to be distributed. So if you need one shot, I will just go ahead and get this one. If you would have asked me that question, let's say 3-4 months ago, I will say, if you need to get some protection, get the bivalent. And if you had a kind of a recent infection, I will say maybe it's okay to wait, because you probably had some immunity from that infection until you get this new shot. But right now that we have this product coming, I will just go ahead and get this one. Now, there are some other interesting discussion on what is the correct timing and when
Yeah.
to get the shot.
Mhm.
And that goes back to try to figure it out when is going to be the peak of a respiratory season, you know.
Mhm.
So, we think about maybe 5-6 months starting in September. So there's always been whether it's okay to maybe wait a little bit longer. So if it maybe gets late, maybe I'm okay. Or if I get it too early, maybe by the end of the season, I might not be necessarily that covered. My personal opinion, I think trying to time when that peak is gonna come is very tricky.
Mhm.
You can go and look at historical data on when are the peaks on when the influenza transmission, for example, has happened, which is there's a lot of trove of data for many years back. And you can see that there's a lot of variability when that peak is gonna come. So frankly, I will suggest just to get it now. It's already October. I think this is the perfect time to get it done. Instead of maybe trying to get it early, because one, maybe the peak is gonna come back earlier, or two, maybe you try to time it and then you forget it, and then you don't get the shot at all. So if you can get it, I will just go ahead and do it.
Okay, so there is some not there is a little truth to that. So maybe not, later into the flu season, but protecting yourself when you're really well into the season.
Yeah, and I know people try to, and we also have the same discussions, for example, when we talk about the requirements for influenza vaccination for healthcare providers, when to get that started. And we always have that discussion throughout the years. There's always figure it out if maybe giving it early, quote unquote early, maybe if the peak is late, maybe your immunization might have waned. But trying to predict that is very tricky, very tricky.
Mhm,
So I
mhm.
think October, I mean, we're basically in October right now. So I will not wait to try to time that.
Okay, so is this considered like maybe the middle of our flu season, or there's still the
I
beginning?
think we're just getting started at this point, though.
Okay.
So again, I will say September, October, November. I mean, we have seen kind of late, even March, some transmission. So again, I will not try to time that, because I think you'll fail most likely.
Mhm.
So I will just go ahead and get it done.
Mhm. So I have one more question for our audience, and that is, there seems to be a growing amount of people who are afraid of vaccinations. When educating patients who are fearful of vaccines, how do you help them overcome their fears?
Yeah, no, obviously I mean, sadly, it's become a touchy subject, and I mean that can be a full conversation right there. But
Yeah.
um, I think we can talk about all the scientific data. We know that is effective in decreasing the chances of you getting very sick. We know that is very good in decreasing the chances of you dying from disease.
Mhm.
There's some effect in transmission, maybe not as good as we wanted it to be, but I think there's a good effect. So I can talk about that, all the data, and but I have to recognize that there is an emotional component to this. There is a cultural component. There is a social component. So I think when we have these conversations on why the vaccine is a good thing, it's not only the science behind, but I think it's good to always try to have a personal approach on why there might be some concerns about vaccine. And again, I think the first thing that that we have to acknowledge that is obviously there were newer compounds. Obviously, there's always a concern, and I think it's completely understandable to have certain concerns with any new product, though.
Mhm.
But we have been using this for some time already, and I think the proof that we have on safety, I think the record is very good. So I think that part, I think it's maybe less of a situation. I think you have to be very very empathic with patients to try to maybe understand where they're coming, because saying no to vaccines is a very broad brush. Some patients are into maybe the doubt, and I
Mhm.
think if you're very empathetic and understanding where they're coming from,
Mhm.
I think many of those patients and parents, I think in the end, they might feel more comfortable talking to a healthcare provider, somebody that gives some reassurance and understanding where they're coming from. So and again, I give you some examples. You know, if you have a person, a relative that might have had a bad reaction to a vaccine, I mean, it's something that obviously that you have to acknowledge. You know, you can't say that's not. I mean, we know that there are some reports out there, but it's difficult to dissociate that anecdote or that case versus all the humongous number of patients who have received these vaccines and they have had no problems, that they have benefited tremendously from those vaccines.
So in the spirit of education, what are some resources that our audience can maybe leverage to really find out the COVID-19 numbers? What are some trusted websites that you would recommend?
Yeah, I will start with, you know, trying to understand a little bit of the local situation, which is obviously what you are kind of more maybe, you know, interested in a way, you know. So I will start with the Wisconsin Health Department. They have excellent data on what's the current situation for influenza, for COVID-19. There are some national entities that do that, like the Centers for Disease Control and Prevention. And during the pandemic, there were some other websites that had an excellent way to monitor transmission and number of cases. I think in general, knowing that maybe we have been somewhat lucky that this variant is maybe not as bad as it was with the Delta and some other before. I think the minutia of getting every single case, maybe that has passed a little bit. But I think, you know, you have the dashboard from Johns Hopkins for COVID-19. Some newspapers like New York Times, for example, had an excellent website tracking the data, which they don't do that anymore. But that historical data, you can look into it. So I will start with the health department, and obviously Wisconsin Health Department for our purposes will be my first go-to source of information for knowing what's happening in the community. You know, we had seen maybe some upsurge of cases of COVID, of cases getting admitted to the hospital. That may have been maybe a little bit of a downtick, but you know, we're maybe kind of looking into what's going to happen later on when winter comes and we are kind of at home and maybe, you know, closer proximity. So it will be very important, and also knowing those numbers might have some implications on you know, do we need to, for example, for hospitals, do we need to implement masking again, for example? So it will be very important for us also to track those numbers.
Wonderful. And well, with that, I want to thank you, Dr. Figueroa Castro, for joining us today. We appreciate you taking the time to really talk to us about this very important topic. So thank you.
My pleasure.
Yes. And folks, if we didn't get to your questions, we're so sorry, but please feel free to send us your questions or your notes to conversations@mcw.edu. I hope you all join us next month for a virtual coffee break and a conversation with the scientists. Have a good day.